it's Dr. Frank Barone at Evolve Plastic Surgery Medical Aesthetics, and today we're in our main procedure room to talk about a very exciting topic that we have great interest in, and that is hair regeneration with the use of human growth factors and stem cells. And my good friend Mike is here from Wiki Medical to discuss this with us. So basically we see many patients, female as well as males, who suffer from hair loss. Sometimes it's genetic, sometimes it's age related, there's many reasons. And our patient today, as you can see, still has hair follicles here, but has some thinning over the entire crown of the head, and the hair, which originates from the follicles underneath the skin and the scalp, as the follicle starts to become less active, it may be from male hormones or other factors, the use of growth factors and stem cells is an exciting new area to stimulate this and naturally enhance and regrow and re-stimulate these follicles. So we're going to draw blood from the patient and extract the growth factors and platelets. That's called PRP, platelet-rich plasma. So that has a cocktail of different growth factors, and the platelets have granules and other things that stimulate growth. Then we're going to draw a little bit of fat from his abdomen, where we all have a little excess, and we're going to extract the fat cells and get rid of the other stuff. And within those fat cells there will be stem cells. These stem cells are the exciting thing. These are omnipotent cells that can reduce inflammation and can also stimulate the growth of many different things. So when we add the PRP to the stem cells, that enhances the effect dramatically, and research studies have proven this. So Mike, you want to say a little bit about this procedure?
Yeah. So what we'll be doing today, as Dr. Barone has mentioned, is we're going to be doing what we call a regenerative procedure for hair restoration. The body has an amazing ability to heal itself, and we're going to be extracting, as he said, the growth factors along with these fat stem cells. It's important that both of these work together to be able to stimulate and to be able to regrow new hair follicles.
And the great thing about this is, unlike topical products like minoxidil and other medications that patients use every day, the effect of stimulated stem cells with growth factors will last for many months, and we then will be using a new protocol with topical growth factors that the patient can use at home, or the use of microneedling, which will help us get growth factors into the scalp, which is done in the office. Now this procedure can be done without general anesthesia. The patient will have some local anesthetic. It can be done in the office, and then he'll go home, shower the next day, and start applying the growth factors. But the longer lasting effect and the actual stimulation of the patient's native follicles is a real exciting thing about using PRP with stem cells, and we expect this to last far longer. And also it's been shown that some follicles that were dormant and people who have lost their hair can be re-stimulated with the stem cell effect, which is quite remarkable and unlike any other application we have, and may help some patients avoid total hair loss and the need for surgery or hair transplant. So we'll follow up later with a report back to you on how our patient here is doing, and we thank you for your attention.